So, hi, I'm David Kiely. I'm a chest consultant in Sheffield. I've been a consultant in pulmonary hypertension now for nearly 20 years, working with Ian Armstrong, the chair of the Patients Association for all that time, for my sins. I'm now the lead of the National Audit, taking over from Simon Gibbs, who has led the audit now for 10 years. And it's amazing to think that the National Audit of Pulmonary Hypertension has been around now for 10 years. What is the National Audit? Well, medical audit's really about trying to improve standards of healthcare. So what we do in medical audit is we compare performance against a number of standards which are derived to try and reflect what's important to patients, to clinicians, and also to commissioners, the people who pay for healthcare. So when the National Pulmonary Hypertension Audit was conceived 10 years ago, it was initially funded by the Patients Association. So they provided the funding for the first year. And when the audit was initially conceived, one of the big challenges was trying to identify how many patients had pulmonary hypertension, how many people were receiving treatment. So in the very beginning, the audit was very much just about trying to understand a little bit about the activity within the pulmonary hypertension centres to try and help us plan for services in the future. Where does the National Pulmonary Hypertension Audit sit? So within the NHS, it sits within an organisation called NHS Digital. They're an organisation who are used to managing huge amounts of healthcare data, and we're very fortunate, I think, that the Pulmonary Hypertension Audit sits within NHS Digital. Obviously, within the NHS, things are always changing and evolving, and there's a greater recognition now of the importance of people who work in, for example, NHS Digital to get out more in terms of finding out a little bit more about what these different conditions, how they impact patients, and actually going to the physical environments where patients are managed. Yes, so National Audit's all about trying to improve healthcare, and what's done usually in National Audit is you identify a number of standards that you want to assess hospitals' performance against. So when we were trying to identify what standards were important and relevant to patients, to people affected by pulmonary hypertension, to commissioners, and also to physicians, we had a meeting with a variety of different stakeholders, and we identified a number of standards that we thought were important in terms of delivering high quality healthcare for people affected by pulmonary hypertension. And one of the very important stakeholders was the PHA UK and the patient population, including not just patients but also people affected by pulmonary hypertension. And as part of those standards that were identified, the patient population were asked to rank those in terms of what they felt to be most important. So it may well be that for people managing pulmonary hypertension in the pulmonary hypertension centres, that they may feel that certain standards are particularly relevant to their practice. But what was really important and key about the National Audit was that patients and their families had an opportunity to identify what they felt was important. The number one ranking was regarding quality of life, and the people affected by pulmonary hypertension were very clear that quality of life was a very important goal of treatment. So at the beginning of the audit, we tried to identify what percentage of patients were actually completing the quality of life questionnaire every year. And so over time, the standard, so the percentage that people need to attain has crept up over time. So the current standard is that 90% of patients should complete a quality of life questionnaire within a year. And I think it's very positive that we can say that overall in the UK, it's 96% of patients complete a quality of life questionnaire each year. What was second was identified as the second biggest priority was to be seen on a regular basis, and the patient community and people affected by pulmonary hypertension, people's families were very keen that there was a contact with a specialist. So one of the standards is that you have to see a pulmonary hypertension specialist at least once a year. And the standard is set at 90%. And again, we've seen that standard increase over time. And 96% of patients with a diagnosis of pulmonary hypertension managed in the pulmonary hypertension centre are seen at least once a year. Now, people may well say, why is it not 100%? But there's often reasons why people sometimes can't travel or different things happen. So I think what's really important is that we set a standard and we make sure that that standard and that level that we're aiming for is appropriate. And it may well be if all centres exceed that standard, that we may well over time then increase the level that we expect those centres to be obtaining. The third standard that was scored very highly was that people affected by pulmonary hypertension were obviously very keen that they were seen, diagnosed and treated in a timely manner. And one of the difficulties, of course, for people with pulmonary hypertension is the symptoms are fairly non-specific. So people have often seen lots of different people before they're finally diagnosed. So one of the very important things to do when we were setting up the pulmonary hypertension services was that we were very keen to make sure that people were assessed in a very timely manner. And I think it's very positive that we've seen over time that the standard that we're achieving in the pulmonary hypertension centres has increased very significantly. So there's an ambitious target that 95% of people are seen within a particular time window, and this year in the national audit, nearly 99% of patients achieved that target. So another important question that was asked to patients regarding the standards was the importance of a diagnostic test. And of course, with pulmonary hypertension, there's lots of ways of trying to estimate the pressure in the lungs. And pulmonary hypertension is a condition which is defined by increased pressure in the lungs. But the gold standard for diagnosing pulmonary hypertension is a test called a right heart catheter, which I know that many of you will have had performed. And it's a needle that's put into a vein, often in the neck or in the groin, and we can pass a small catheter up and into the blood vessels in the lungs to measure the pressure. And that's the gold standard for measuring pressure. Now, there may be circumstances in which you don't necessarily need to have a cardiac catheter performed. So there are certain conditions where the non-invasive test that you have performed would be sufficient to allow a diagnosis of pulmonary hypertension to be made. And so within the national audit, there are certain conditions where a test such as cardiac catheterization is not mandatory. And of course, there might be reasons why people can't have a cardiac catheter. The patient may be very, very sick on occasion, and you might want to start treatment before doing a test like cardiac catheterization because you feel all the information that's there is enough to allow you to make that decision. So there are sometimes reasons why you may not have had a cardiac catheter, but because it's the gold standard test, and in some patients who don't have any other obvious cause for pulmonary hypertension, we might want to give a gas mixture to ask you to breathe in when you're having your catheter performed, see if the pressure changes, because that can sometimes identify patients who might benefit from a specific form of treatment. As a community, we feel that performing a cardiac catheter is a very important test. So we have a standard that 95% of patients who are receiving treatment for pulmonary arterial hypertension of a specific form should undergo a test called a cardiac catheter. And we can see again this year that we've seen increasing number of patients undergoing cardiac catheterization, and that target has been surpassed. And of course, if we are delivering and meeting these standards, that we continue to drive and think about identifying new standards that will continue to drive up the care that we provide for people affected by pulmonary hypertension.
Well, just over 10 years ago, we put up the initial funding for the foundation of the national audit. And then since then, the clinical community, commissioners, all the stakeholders saw real value in it. So we wanted to ensure that the service that was being delivered in the various specialist centres across the UK were meeting not just minimum standards, but high standards of care. So that's why we put up the initial funding for it. People are greatly encouraged by there being a national audit in which, regardless of where you live in the UK, that the access to the service that's available throughout the UK is really high, is consistent across the board. And if there are any issues, we've got a process in which they're identified immediately and are dealt with, and it's across the board. So I would be greatly encouraged that not only people striving to deliver high quality care in the UK, a high quality care is being delivered.